the more difficult posts talking about struggle and pain and difficulties with receiving diagnosis or treatment, I want to be very transparent about my experience because a lot of people can relate to that, and I like that it helps people not feel alone. But just because I say that doesn't mean I want to have a further nuanced conversation about it. It's just sometimes engaging in that it's too much there, and a lot of the time I am getting very specific medical advice, and I am not able to answer those questions. I really needed to set that boundary because I have been struggling a lot because I am unpacking my PTSD with a therapist. My gastroparesis symptoms in particular had started at the beginning of high school, and they were getting to the point where I was starting to have flares where I couldn't eat and I'd lose weight rapidly.
So I know mine too a bit different because mine only goes into my stomach, but yours goes, I think, into your small intestine.
Mm-hmm.
So I'm assuming that you have to eat slower?
Right. So I do have a GJ tube, which means I feed myself and give myself medication through the J port.
I'm over it, but like for you, do you like enjoy food anymore? Like the
Food,
taste of food and like swallowing it?
food and I have a very complicated relationship. Like I would take a bite and wait like 10 minutes and then go and take another bite. And wait maybe like 10 or 15 minutes.
You're really committed to it.
Oh yeah. I understand what you mean about that. You can't just like chew it and spit it out.
No, you need the entire experience or...
Yeah. 2 tenured professors there. And I'm going to refrain from using names.
I mean, you kind of you narrowed it down pretty well.
Oh, no, I know. That's intentional. I'm basically... And everybody's proposing a thesis. And this woman turns to me and she says, I think you're too sick. I don't think you can do this. Capitalism for somebody else. So it's like, yeah, do this, be gentle to yourself. But it's like when you have to do so much extra work to navigate the system, it's like another job onto itself. Which...
It's an obstacle that you shouldn't have to deal with.
Right, and I mean...
Well, I wanted to know, like, what do you learn in women's studies? Hello, welcome to my podcast, to Mics One JoeySooch. I am Joey Sooch, and I'll be giving a mic to Emily. She has hypermobility Ehlers-Danlos syndrome, had a gastrotomy, tracheostomy tube to help with gastroparesis, also deal with post-diagnosis, chronic migraine, fibromyalgia. Don't worry guys, I'll explain all the diseases in a little bit. Emily has also just received her master's in women, gender, and sexuality. Now she is on her way to become a lawyer. I hope there's order in this podcast or things will get ugly. How are you today?
I am doing alright, excited to get into the meaty stuff of the topics today.
I think it'd be very jam-packed. But the question is, are we allowed to trauma dump here?
Okay, yes. So here I'll go ahead and say yes. We can have this discussion. This is a consenting trauma dump. It's just non-consensual trauma dumping. We don't stand for that.
Yeah, for the audience that doesn't understand, in Emily's bio, she has like the big red X emoji, like no trauma dumping here. So I guess it happens so often that you have to actually say something.
Yeah, and you know, you want to help as many people as you can, and I understand that the diagnostic process is very difficult, and there are people that are getting to the points that I've been at, but I'm not a health practitioner, and I am not a mental health practitioner either, so I'm not the best person to talk to, and it also, it just does kind of weigh very heavy on me, because I can't really help these people. All I can do is say, this is what happened to me, and I wish the best for you. It can also be incredibly triggering. I do I do battle with complex PTSD for a variety of trauma that I won't get into too much detail, but some of it is medical trauma. So when people bring these scenarios to me, sometimes they are triggering and it puts me into a really unhealthy place. So I just need that boundary to be respected. And so far it hasn't been. So I needed to just put it back out there out into the internet.
Yeah, I mean, I think medical PTSD is relatively new. I mean, the idea of it is not new, obviously, but I think the term is new. That I think a lot more. I think the past 2 years. I don't know if it's just me because I'm being more submersive into the rare disease chronic world, but I feel like it's a new term that just came to light that now people are able to like diagnose and put a finger on it now.
And I think that awareness of mental health disorders too is the fact that we're becoming more aware of these terms because they've existed in psychiatric manuals for years, but because we're the lay person, we don't know about them unless somebody brings it down to our level to understand.
Yeah, I mean, I can understand like why someone would rather talk to, let's say, a person that, well, for one, everyone thinks that like, oh, if you're posting all this like dark stuff, like it kind of opens the conversation up. Someone wants to talk, like you can talk to them, man. I mean, I get it to an extent, but at the same time, they're just expressing themselves how they want to express themselves, but doesn't necessarily mean that when it comes to a personal relationship, we're going to continue that conversation because sometimes writing the caption down and then writing the caption takes a lot of like effort and I guess stress and like you're reliving it. And then the another thing is pressing the submit button. That's hard for a lot of people. And then there's relief, but then it's kind of like once you write it down, you're kind of relieved by it, but then others will come and like re-trigger it and you don't want to, kind of like you're at peace with it.
Yeah, I mean, a lot of the times, especially with the more difficult posts talking about struggle and pain and difficulties with receiving diagnosis or treatment, I I want to be very transparent about my experience because a lot of people can relate to that, and I like that it helps people not feel alone. But just because I say that doesn't mean I want to have a further nuanced conversation about it. Hitting that submit button means that I can just kind of talk about how I'm feeling in a way that might get people thinking, which for me is really important as a scholar too. I like to get people thinking about things. It's just sometimes engaging in that it's too much there, and a lot of the time I am getting very specific medical advice and I am not able to answer those questions.
Are
And
you, do you post to educate new people or are you trying to gather a audience that are more similar to you?
I'm at the intersection of both because for me I have a little bit of difficulty going too much into the teaching realm of things because at the end of the day I still want this to be fun, and I can make it educational and fun, but that requires a lot of research, and to be just honest, I don't have that kind of time. I work a full-time job, I'm studying for the LSAT, I'm disabled, you know, so it's like I try to get informational content out there when I can. I try to pay attention to, awareness times, like get something out there so people know what's going on, have some basic facts and some resources they could potentially find more information on. But I am by no means going to educate to the point that I would consider myself an activist, because I consider activism to be a like a high tier job, and it requires a lot of work. I consider myself an advocate and potentially like an advocate and a lifestyle blogger. That's what I consider my content to be, because it's ultimately, yes, my experience and a little bit of education. For a while, I've been trying to find a little bit more of a niche because I don't really know what I'm doing. And I think that's okay too. I'm just having fun. And I really appreciate the small community that I have built. Everybody's really supportive, and I've met a bunch of tubies, so that's really nice, and it's made the experience so much less isolating, after going through getting the tube the past couple months. So I just find it fulfilling without necessarily a specific ends to it. I'm just having fun.
Yeah, I mean, I think feel like that's the best way to kind of go about Instagram. Like, there's some that do advocating. It requires a lot of work. Some people do it as a full-time job, and like you said, you don't even have the time to do it. And like I can understand when you put the boundaries up. Like, it's okay to have like a conversation in like the comment section because it's very like quick. Like one question, one answer, you're done. Like when you have it, you don't have time to have an interpersonal conversation because you you don't have the time. Like that's like you have to worry about yourself, and like that's what doctors are there for. You know, they get paid to help you, and you gotta contact them. I mean, I'm sure you help them sometimes, but you know, you can't be the answers to everything.
Right. And I mean, I try to. Sometimes I get just like, oh, my son has this, and it's like, I don't know how you want me to respond to this. And it's
Well,
like, that like I just get like random couple of like sentences, but I really needed to set that boundary because I have been struggling a lot because I am unpacking my PTSD with a therapist. So yeah, boundaries are important. Talking to people who are qualified to aid you is important.
yeah, I totally gotta have the healthy boundaries because especially like the parents, they don't really know what the conversation really is. Like this, I guess I'm lucky that there's not that many of me around, so no one can come to me for trauma dumping. But just I do get questioned all the time, and if it's like, can you do this or that, and I'll just say yes or no or something. But I don't engage in long conversation because it's not worth it to me. Like you're just gonna forget about it next day. I can't. I kind of rather help people that will actually need it. So like, how do you get dressed in the morning? Like for me to help you, that will help you a lot because maybe you do have that problem though. But I'm not just gonna tell a random person like how I do this. Like it's a curious thing, but it's not gonna help in any way.
Right. It's like I
So
understand you're curious, but this is a little intrusive. Like,
um, yeah, like some just talk to me like we're friends already. I'm like, we have to have like little boundaries. Like we're just not that way. But it's hard out there. But like you gotta, I don't know. Like sometimes some people will like be, I don't know. There's like a vibe they bring, and it makes it more like comforting in a way. That
oh
makes
yeah,
sense.
you can tell when someone's coming from a genuine place, whereas others are just like, I want to know this about you, and just ask you a bunch of questions about your life for my own enjoyment. Um,
Well, a weird question is, do you get messages of like from fetish people, like disabled fetish type people?
no, thankfully I have not, and
Really?
I
I
think
feel like you would get a ton.
I got I have had a few messages of like spam people like offering to be my sugar mama or my sugar daddy,
Oh
but
man.
but like it's a scam, so it's like no, and I'm engaged, I'm happy, like I don't want to like that. If somebody approached me with a fetish, I think I wouldn't log on to Instagram for at least a week because I'd be so uncomfortable.
Really?
Yeah.
I tell my other friend if she ever gets like if they need like beef photos, just tell me and you can split the profit.
I mean, like, I'm not necessarily like kink shaming, even though like a lot of people aren't respectful of disabled people when they say they have a like kink towards disability. It's just like, I am not consenting for you to be attracted to me in that way because I'm disabled, because I have a tube, or because I use like mobility aids. So it's like that just puts me in a weird spot where it's like, have you done any, like, have you looked at these pictures and like pleasured yourself, because now I'm uncomfortable
I
and
mean,
you're asking me
I don't
for
understand it,
things.
honest. I don't understand it, like what. I don't understand it, but I mean, I never got a message, so I'm just basing it on others, but I don't really understand it. But I told my other friend if they want feet photos, to tell me and I'll take a picture of my feet and we'll just split the profit and win-win for both of us.
Hmm.
But
No, I get it. I mean, a lot of my response has to do with like negative experiences with men too. So that's, I have to
well,
factor that into that.
yeah, of course, depends how you go at it. Like for me, it's like a fun kind of thing, like, oh, but I can understand from your perspective that maybe it
Oh,
will rub you the wrong way. And
oh, those sugar mama and sugar daddy posts though got me cracking up. I love those ones.
I mean, you wouldn't have to work 2 jobs anymore. That'd be nice.
That would be nice. Gosh, but I've been working 2 jobs for like a couple of years now. It'd be, well, actually now, right now I'm not working 2 jobs for the first time in a long time. That I made that transition after I took a medical leave from the vet's office I worked at because of the feeding tube stuff. Um,
Well, let's go into the whole. I know you all wanted to talk about the whole college experience. So I have here that you were getting so sick that doctors were concerned about your long-term health. What
mhm.
is the stress of school or your job or just everything happening at the same time?
It was everything happening at the same time. So when I was starting graduate school, I had already been sick for a while. My gastroparesis symptoms in particular had started at the beginning of high school, and they were getting to the point where I was starting to have flares where I couldn't eat and I'd lose weight rapidly.
Wait, so just for the audience, a gastroparesis is, I believe, it's paralysis of the stomach.
Yes, so it is a stomach dysmotility condition. Sorry, that totally went from my head. And it literally means paralyzed stomach in Greek. So my stomach is partially paralyzed, which means that I cannot digest food very quickly, and therefore volume is not good for me. I can fill up on water and be full for a long time and not get enough nutrition, which was a lot of the times the case. And I actually started battling with malnutrition because I couldn't eat enough. I was getting in 1 to 2 meals a day on top of working 3 jobs at one point. So I was teaching 2 classes, well, teacher assisting, 2 classes at FAU. I was also working for the Equity Center at FAU. They have an outpost in one of their freshman dorms, so I had to man that at night. And then I had my retail job, which was paying most of my bills so I could pay my rent. When I was able to get out of that retail situation, I started a more physical job. I started working at a dog rescue. So the combined gastroparesis getting worse, the hypermobility, my joints dislocating all the time, and the extra physical labor had my doctors very concerned. So it was basically over the course of about 2 years, so the entirety of my graduate degree, that things got progressively worse and worse to the point where I had to get, more immediate surgical intervention with the feeding tube.
So you're saying so most of school you just dealt with the issue without a tube?
Mm-hmm. The
Man,
tube is a recent addition.
I'm surprised it kind of took so long due to I just surprised it took so long. Like, was it on you or the doctors or?
It was an irresponsible move on the gastroenterologist I was seeing at the time. She ordered the gastric emptying study after I finally did get diagnosed with Ehlers-Danlos syndrome in 2019, if I'm not mistaken. And the results of the gastric emptying study showed that I still had 65% of my stomach contents at hour 4. So I should have had medical intervention at that point, but she didn't even tell me how bad my results were. So I went another 2 years not knowing.
So I'm assuming the thing you have in your camera shot now is you're being fed as we speak.
Mm-hmm. So, normally, like, if I'm working, this is my IV pole, I would have it set up, but since we're talking and I'll be moving around today, I have my medical bag set up. Just makes things a little easier than walking around with a
Yeah.
IV pole up and downstairs.
Yeah. But we have in common that we both have tubes actually.
Oh, really?
Yeah, I have a feeding tube, but I don't. My problem is that I actually cannot swallow to my throat. So like, if you ever see me with my cup, I can't swallow my saliva, so I have to spit it out. So like, but I do have a tube, and unfortunately with my disability, I can't feed myself, so I need someone to feed me. And so, but like how? So I know my tube is different because mine only goes into my stomach, but yours goes, I think, into your small intestine.
Mm-hmm.
So I'm assuming that you have to eat slower.
Right. So I do have a GJ tube, which means I feed myself and give myself medication through the J port. I basically only use the J port if I need to vent or drain my stomach if it's upset. I never use it because otherwise whatever I put there is just going to sit there. And my medications make me incredibly ill, so I have to make sure I put them through the J port.
Wait, so the J port goes into your small intestine, right?
Mm-hmm. It goes into the jejunum.
And that solves all your feeding problems?
Yeah, I am still encouraged to try to eat so my stomach doesn't get worse, which is, it seems counterintuitive because then the symptoms don't get better. But because I'm not at a too terrible of a point right now where I'm totally rejecting all food, they want me to at least try to eat here and there. Just
Well,
because things can get worse if you
well, it's kind of a weird thing because like when I was needing to get the tube, I kept choking and everything, so like food was trauma to me in a way. And like, but now I'm over it. But like for you, do you like enjoy food anymore? Like the
food
taste of food and like swallowing it?
food and I have a very complicated relationship because I love it and it doesn't love me. I don't see that because of the nature of the condition I have, even my safe foods cannot be safe on some days. So it's like playing Russian roulette with food. At least in my case. I still try. I try to keep it bland, but sometimes you just want to be human and eat something good. So like 2 weeks ago I made latkes. My latke I had to take 2.5 hours to eat it, but I finally ate the whole thing, and it made me feel terrible, but I was very happy that I ate it.
I'm surprised you kind of ate the whole thing. I thought you would just take like a bite and then just be done with it.
Oh, I mean, it was very slow. Like, I would take a bite and wait like 10 minutes, and then go and take another bite. And wait maybe like 10 or 15
Man, you're
minutes.
really committed to it.
Oh, yeah. I've wanted, listen, I was craving those latkes for about 2 months, and then I realized I had the stuff to make them. Yeah, so it had to happen.
Wait, what is latkes?
So latkes are potato pancakes. specifically like Jewish potato pancakes. So I guess maybe I should just call them potato pancakes because you are supposed to use like matzah or certain flour in it. But I did use a special flour, so I'm not technically sure what to call it. But they're
Um,
potato pancakes. They have
I'm just
potato, onion.
I'm just looking it up right now because I don't think I have ever seen potato pancakes.
Yeah, and you eat them with either sour cream or applesauce.
Really?
Yeah, it's a very like Eastern Bloc thing.
I don't even know what they look like. They're like, I mean, they're like mini pancakes,
It's like
but
if a
what's in
pancake and a
them though?
hash brown had a baby.
Yeah, that's a good description. But like, what's in it though?
It's a potato, onion, a little bit of just salt and pepper, and egg and flour.
It kind of reminds me of a pierogi.
Really?
About the potato part.
The potato part.
Yeah, I love pierogies.
I You gotta try a latke. I promise you'll like it.
I'll add it to my list, but like, I don't have any desire to eat food, just
Mhm.
because, like, my satisfaction is eating it, but also swallowing it. And since I
Right.
can't swallow, I just don't even try. Like, there's no point. But like, one day I'm gonna do like a YouTube video, and like, I haven't eaten food in 5 years, and I'm gonna make a video like one time with my friend, and she'll give me things to try and see if I can remember what things taste like.
Oh my gosh. Yeah, I mean, I understand what you mean about the you can't just like chew it and spit it out.
No, you need the
It's
entire experience, or
yeah, it's it's just such a tease, and then your mouth starts salivating and starts the digestion process, and it's yeah.
I think for me it gets better in time. I mean, like I'll go out to dinner with friends and such, and like it really does. I mean, it sucks in a way, but at the same time, is for me it's kind of boring because like when everyone's eating, I'm just sitting there.
Hmm.
I like. I mean, I eat beforehand because when you around food you get hungry, so I eat beforehand, so I'm fine. Like I'm satisfied in terms of like my body, but it's just boring because everyone's eating and like like pass the salt and pepper, and I'm just sitting there like with an empty plate, and it's like a little awkward. And you like the waiter's like, "Oh, what do you want?" It's like
It's
nothing.
like yeah, it's like I'm
Yeah,
good. I'm actually like I ate before I came here.
yeah. I'm
Like
just here for friends.
yeah, if they get really pushy, I'm like, listen, I'm eating right now, and you didn't even know it.
I mean, they see me that I'm so disabled that they don't even like. They just like, okay, like kind of. I guess, I guess they can't like. I know you also want to get to ableism, so I guess we should talk about ableism. But I guess it goes into the ableism. Sometimes they don't even talk to me about what I want for food. They just ignore me completely. So it's like, I guess that's one problem I don't have to worry about. But before we talk about ableism, so you say you had, so during college you were dealing with the Gastroparesis that you should have gotten into much earlier. That I think will have helped tremendously. You're working two jobs that's stressful just for any person. So like, I have here that, so you have experienced tons of ableism getting your thesis done. Did, well, first, do you want me to explain ableism or should I explain it to the audience?
Um, I mean, you can go ahead. I don't want to, if I'm being honest at the
I
moment.
mean, yeah, I know like some people get tired of explaining it all the time.
Yeah.
Yeah. Ableism is really discrimination just from having a disability. It, some of it is warranted, some of it is like really not. So like we'll just give an example. So like you had a thesis, like what was your thesis on?
Um, it's titled Feminist Phenomenologies of Illness, so it's on illness and disability.
Okay, so like what ableism did you experience with that?
So the program I went to was a 2-year program. Is Women, Gender, and Sexuality Studies. It was supposed to be a multidisciplinary program. I went in with very high hopes of working with one of the tenured professors. There are two tenured professors there, and I'm going to refrain from using names
I
because
mean, you kind of you narrowed it down pretty
oh,
well.
oh no, I know. That's intentional. I'm basically gonna like allude to who they are without saying who they are, because they are not very good people after. Anyway, so I had this one teacher who was constantly badgering me. Every single time I saw her, she had some sort of comment to say about my physical appearance. So it started with microaggressions. And when I started using a
Where it started
cane,
with your what?
it started with microaggressions, like you look really sick today. Are you taking care of yourself? Are you doing like,
Terrible. Like, you
and
don't even say that to a normal person.
yeah, but it was every single class. So I was just like, I don't understand what's happening, why you're singling me out for this. But she would tell me like, you're looking really tired. Are you getting enough sleep? Have you seen the doctor recently? Like,
Oh my god, that's so invasive.
and I barely knew this lady.
Yeah,
Because
I
this
mean,
was,
I can understand, like, if, let's say I'm working with you for a while and then, like, you don't look good one day or, like, couple days, then I would be concerned. But, like, every day, like, my God.
yeah, and, sh- you know, because I didn't have my HEDS diagnosis at the time, I couldn't get registered with student accessibility services. I got denied when I applied the first time, even though
Wait,
at
but
that point,
wait, begin your, before you continue your story, do you have a disability that's apparent to people? Like, are you in a wheelchair or any mobility aids or anything?
so I do use a cane, and if I'm traveling now, I'll use a crutch. That's a more recent thing, but unless I have a midriff or I'm using my cane, you can't tell I'm disabled.
Okay. Yeah, I did kind of want to paint a better picture for me and then the audience.
Yeah.
Like the person judging you just if you look completely normal or are you having some kind of
Yeah.
need for aids.
Oh, I mean, I'm wearing a bunch of braces, but I tend to, because of Florida, I have to wear a lot of compression gear too. So you can kind of see the outlines of them.
Mm-hmm.
If you're looking and paying attention to me, you can tell that something's off. Because, like, my hips just look, they out all the time. My hips are popping out either way. SI joints, they get out more than I do.
But
And my knees.
you mean your joints or your like
Yeah, my joints. they're
okay.
they're pretty they're out on the town all the time. So I have to wear a hip brace a lot and my knee braces.
Yeah.
And I'll
Yeah,
wear
that's
like
for the audience that's part of the Ehlers-Danlos syndrome, the your hips just come out of place and one of the things they do is wear braces to mitigate that. It helps a little bit, but not perfect, but it does help.
and like I have to wear compression pants and compression socks and most of the times like compression shirt, but it's hard for me to wear those now because of the tube. I
I
have
mean,
to
it must
start
be difficult
propping.
just being in Florida too.
Yes. I don't leave the house. It's so hot. I will pass out from the POTS. I do get the syncope episodes, which is one of the reasons why I have a service dog in training.
So you're wearing compression things, you're wearing the brace. This lady is telling you that you don't look good every single day. And then,
And it comes time for our first year review. We go ahead and go over our papers for the entire year that we did for our classes. And everybody's proposing a thesis. And this woman turns to me and she says, I think you're too sick. I don't think you can do this. And when I asked her to elaborate, she said, this is a challenge for anybody, but with how sick you are, I don't believe you can do
does she
this.
even know you're sick though? Like, does she have access to your records or anything?
She did know that I was dealing with health conditions just because she was a tenured professor and taught most of like the core classes. So
Mm-hmm.
I did have to communicate with her with absences. So she was aware of what was happening and she was using it against me to try to say I couldn't perform for the thesis. and she was forced into my committee, and I didn't want her to be there. And towards the end of it, when it came to defend my proposal, she tried to shut it down because I kicked her off my committee.
Nice.
Oh, I was incredibly unprofessional about it. I didn't talk to her about it at all. I just replaced her.
I didn't know you could do that.
Oh, you're technically not supposed to. I had already put in a complaint with the dean dealing about this woman and dealing with her on a day-to-day basis, so I had escalated it up as far as I could. And I think at that point they were just like, let's not mess around with this anymore. There's clearly an issue between these two people. Let's.
Well, the thing about the tenure is that they can't get fired. That makes it 10 times more difficult.
Exactly. So, yeah. And she's a very reputable person in the sphere of ecofeminism. So, she's a value to the universe. She was incredibly ableist to me. She attacked me for my. She wasn't open to other forms of pedagogy, and I tried to work with her, and she just wasn't open. She constantly misgendered my classmates that were non-binary. She tried to say she was disabled because Sense gave her headaches, not migraines, headaches. Very interesting woman.
Sorry, I'm just laughing because it's so like absurd.
Oh no, it's interesting. I mean, if for whatever reason she were to ever see this, I know she would 100% disagree with everything I'm saying, but this is.
Well, she can deal with me because I don't care.
Yeah, exactly. I mean, I don't care. I don't care if she cares.
Well, you graduated, so you're good now. You're free.
Free. The degree's up there with
Well,
the
I mean,
thesis.
it's not. I mean, I feel like your job as a professor is to help people on their path to whatever they're wanting to do. Like that's your whole. That's like what you signed up for. So it's like super unprofessional and it's super, I guess, characteristic of a professor that you're wanting to stop the person. Like, if so, what? I mean, I guess if so, what if she's sick or you think she's sick? Like she clearly wanting to do the job. Like you submitted your thesis and help her do it. And if she fail, let her fail on her own. Don't just put the nail in her coffin before she even starts. Like that's just not fair. And like, I believe you have a 3.5, 3.85 GPA, right? You graduated, so that's really impressive just by itself. And then now hearing all the things, all the shit you've been through, it's even more impressive. Like not only the professor screwing you, but like the doctor screwed you for 2 years, too. So you were dealing in two different arenas in that point, and then, but like even then, like you had your past, like your professor saw you doing well in the past. So it's like, why is she judging you still now? Like at first I could understand like a person judging disability. Like I think that's just human nature and such. Like it sucks, but I get it. But like if she's a professor for like many of your classes and you're like, let's say getting B plus at A, like after a while just like shut up and just like, like clearly she's smart. Clearly she knows what she's doing. Like why am I gonna keep putting her down now at the end? Like you think after I'm assuming it took 4 years. Well, you said 2 years. So after 1.5 years, you think she's gonna stop now at her thesis? That's like the finish line. Like she's not gonna stop now. It's like give her, maybe not give her a break, but like give her some respect that she wants to do it.
Yeah, I mean, as soon as I had the option to no longer take classes with this woman, I took every class outside of the department that I could. And I hate to be just talking so negatively about this experience, and I hate that it turned out this way because this program should have been great. It should have been a place to talk about equity and diversity and theory and praxis in a
Exactly, you're
safe
on the same
environment.
team.
Exactly. And it was so, it was just such a biased environment. It's like, this is the exact opposite of the work we're doing here. But, you know, things move on. I hope to see more change in the department. The person who took over the department, they are amazing, and I see them doing great things to help other people. It, there's so much to critique within the university system, and not just from my experience, but from others. I've had people come and talk to me in terms of them getting denied by accessibility services. Like, what kind of paperwork do I need? Why is this happening? What do I do to get, like, excused absences? It's rough trying to navigate that space, like, to get the grades you need without accommodations and to be successful to move on to the next step. Because there's the tried and true C's get degrees, but not if you want a professional degree. Not if you want a master's, not if you want a PhD, not if you want to go to law school, not if you want to go to med school. C's do not get degrees for them. So they're the
More like,
level.
see you later.
See you later. Get out. Exactly. It's just like finding the balance between, like, applying yourself to work and, I mean, like, so much of this is also like preparing yourself to be productive in neoliberal capitalism for somebody else. So it's like, yeah, do this, be gentle to yourself, but it's like when you have to do so much extra work to navigate the system, it's like another job onto itself. Which,
It's an obstacle that you shouldn't have to deal with.
right, and I mean, we face this all the time in the medical setting, any form of bureaucracy, any form of, like, aid we want to get from the government. It's that constant, you need to be your own advocate, you need to be your own medical researcher, and it's like, this should be a job at this point. Why am I not getting paid?
Yeah, it's like we talked about it earlier. It's like we talked about, like, advocating. It's difficult, like, social media wise, but we're constantly advocating for ourselves and every aspect of our lives. So it's like school, work, government. Like, you're constantly advocating. It's exhausting. You don't want to. It's like you just don't have enough time, and sometimes you just don't have the energy anymore. You don't want to keep, like, it. That it kind of it equals to medical PTSD, or the kind of reliving that moment 4 times a day, and it's kind of like to me, like, my, like, Instagram to me is, yeah, I do some advocating, but the fun thing, like, I want to go there and have fun, and, like, I'm in the podcast world now, so I kind of have to follow people and, like, learn about them. But some people, they're just too, like, for one, like, sometime I'll come out of the episode and I have to, like, have a breather because every trigger is something that I've done in the past, but that's okay with me because I kind of brought on myself. But, like, on my social media, like, some people are too trauma dumping on their social media all the time. I understand, like, it helps maybe them a lot and helps others to, like, relate to it, but sometimes it just gets too much complaining, and it's like, I can't take it, and I have to, like, unfollow you just because, you know, like, for me, I understand it sucks to have a disability and all the obstacles, but, like, sometimes people are human too, and sometimes I want to see a picture of your dog. Like, I don't want to hear all the bad things all the time because, like, I know already. Like, I don't want to keep being reminded about it, and, like, I know it helps some people and maybe even a shitty opinion, but sometimes for me it's just too much, and, like, I want to get away from it. Sometimes social media, I can't even get away from it because it'll pop up right on my feed, like, this bad thing happened. It's like, it's too much. So I don't, like, do you feel the same way, or am I just a shitty person?
No, I get exactly what you mean. It's like you deal with that and then you have to step away. It's because, like, you're only one person. You can only deal with so much, especially when it does start to hit close to home, and you only have so much emotional labor you can do.
Mm-hmm.
And like you have to be realistic with yourself on that. And if part of that is unplugging for like an hour, because I know like specifically like when we're content creating, you're supposed to be more plugged in.
No, I mean, I'll
I
say,
think you're valid. I think
yeah,
you're 100% valid.
yeah. I mean, I like your post because you kind of, for one, you don't post often, so it's like gray in itself, and two, you kind of post more substantial posts once in a while versus like a mini post every like 2 days. I feel like that's like, so like when I see your post pop up, like I'm not like, oh my god, why did Emily post again? I'm just like, like like I don't know. I feel like it's not as intrusive because I know like to me, I feel like you're a person that like thinks about it and just like puts it together nicely, and then like you post like once in a while. Like it's like it doesn't seem intrusive. Like I'll read this person's caption and like it, agree with it, disagree, and then there's some that'll post like every 2 days like complaining about something, and it's
Yeah.
just
It's
too
exhausting.
much. Like put it in your story, but don't put it on the timeline. Like kind of,
Yeah.
but
No, I 100% agree in the sense that it's like, I get that this is helping you, but like maybe a more productive place to put this would be in a journal or
well
perhaps a
well
Finsta.
the weird thing is that sometimes it helps other people. So it's like maybe it's hurting
It's
like people like me, but if it's helping other people, like as a content creator, do you like stop because you're hurting me, or do you continue because it's helping others?
right.
That's
And like neither of us are in the place to say that either. I mean, it's because I follow a couple of people that I know exactly what you're talking about. They and it's just my opinion. I think they post a little too much about their personal life, but that's because their boundaries are different than my boundaries. So I still follow them because I do like what they post most of the time, and I respect that, but sometimes I just need to not look at their posts or their stories at all for a couple of days after I read about, well, I read things I definitely shouldn't. It's none of my business, and I don't want to give away who it may be by saying what it is.
I mean, I totally get it. Like it kind of like your social media, kind of like your house. You kind of decorate it to the way you like it. So like, on mine, like I follow celebrities and I follow hot, hot women. I follow, like I follow people that have rare chronic diseases. Like, some I follow because they're cute. Like I kind of mix the bag, and it's nice to have that badge. But like now that I'm more submersive in the chronic world, now I'm in like this weird situation. Like I'm following people to like interview them, but like now I'm in this weird situation. Like, do I continue to follow them because we interview each other and like I kind of owe them that? But like at the same time, it's like sometimes it's too much, and sometimes I just don't care. Like sometimes it's just like I guess like one example would be like breast cancer. It doesn't really affect me that much. Like I understand it's extremely bad for the person, and I can't imagine them going to that and such. But sometimes I think to me it depends on how the person portrays themselves.
Mm-hmm.
So like it like you, like I feel like your posts are substantial, so I'm more willing to stay follow to you because I feel like you're posting well.
Thank you.
And yeah, like I feel like you're just, I don't know, it's just the way you wrap your captions up that makes me want to like read it versus just reading the first two lines and just scrolling. Like it's like you make your posting more important.
Thank you. I try really hard on my captions because
Yeah, but like if I can feel that it's kind of like an important post, like you posted it with good reason, and then there's others that post like every 3 days, like, what is it now? It's like okay, like there's one girl I just unfollow because she kept posting all the time, and there'll be like slightly different pictures too, and it's like she would get a ton of likes too, so I get why she does it, but it just bothered me, and I just unfollowed her, and that was it. So sorry, I even forgot her name. So
Yeah, I mean, like, if I do post, I try to keep it to Tuesday and Thursday, but, like, I don't put that pressure on myself because I have so much other crap going on that it's like, if I post, I post.
I
Um,
mean, we both don't have large audiences, and no one are really knowing when we're supposed to post, you know?
exactly. It's like nobody's depending on me to post at every Tuesday, Thursday, and Saturday at 11 a.m. Like,
Yeah, I mean, there'd be those celebrities, those YouTubers would be like, you haven't posted in 2 weeks, and people would be like, well, you didn't post in 2 weeks, and it's like,
it's like
chill.
the
Like,
world stopped.
yeah, it's like, chill.
Yeah.
Just, they're just people too, and they need burnout stuff. Like, YouTube in itself is exhausting. Like, editing takes a long time to do. Creating content takes a long time. Creating almost original ideas takes a long time. So, like, even caption take a long time. Like, I'm sure you write a caption and then you rewrite it like 5 times.
Oh yeah, and I'm the queen of typos. There's always at least one or two typos, even in my finished caption.
Yeah, and it's like you just keep rewriting it. Sometimes you write it a day and then you wait a week. So you're like, oh, I don't like this. Like, you expand on this one. Then you get the right photo, and it's like, it gets exhausting. Am I don't know. I feel like maybe I'm a bad advocate because, like, some of my posts are just funny. Like, I should be advocating because no one knows who I am, per se, but, like, my disease. But, like, I just have fun with it. Like, I like making people laugh, and that's where I get my creative outlet.
Yeah, I think when we start to feel the expectation to post certain things, it no longer brings us joy. Um, we've lost the battle with it. You know, we
I mean,
should.
I still know. I still want to feel annoying too. That's
Oh
really it.
yeah.
Well, I want to know, like, does what do you learn in women's studies?
So, a lot of it is feminist theory. So the history of feminist theory through the first through third slash fourth wave, depending on who you ask. Some
Wait,
people
what's
would.
a wave?
So the waves are how people break down the feminist movement. So the first wave would be female, like the women that were trying to get the right to vote. Then
So
we
that
go
was
into
the 19
like the
or
1910s
tens.
to yeah,
Okay.
like it starts around then, but advocacy for that began much earlier with people like Susan B. Anthony, Sojourner Truth, um, et cetera, et cetera. The second wave is the one that most people are familiar with, the bra burners. Um, so those fighting.
I'm not even familiar with that. What is that?
Oh, so this is going to be more around like starting in the 60s and the 70s. Um, Again, they're kind of called bra
Oh
burners,
wait,
even
this the
though.
one after the World War.
So this will be like a little bit more towards like Korea and Vietnam.
Okay. What,
Um,
there
so
wasn't a wait. There wasn't a women's wave during the war because I remember just from history that all the men went ship out and the women had to replace the men. That
oh yeah.
wasn't a wave in itself.
So technically, it's not considered part of the feminist movement. I mean, it's considered like part of the nationalist, like patriotic movement that happened in the war. So it's more considered like people filling in to do their patriotic duty. Yes, it did give women a right to work in certain places, but some of those things fell through the roof when the men came back. So those rights were not permanent in every case.
I mean, it makes
So
sense. Okay,
yeah,
so we got the second movement, which is the 60s to 70s.
yeah, and this they were advocating a lot for workplace equity. So many women who were allowed to work, they were stuck in certain jobs, such as being a teacher, a nurse, or a secretary. Those were essentially the three jobs that women could get, or maybe they sell Tupperware. You know, something like a stay-at-home mom sells something door to door, and Tupperware was particularly popular in the 60s and 70s. A lot of this sprung out from the anti-war movement as well, and the civil rights movement. Up until this point, the civil rights movement and the feminist movement had butt heads for a really long time because they were fighting essentially for who got the right to vote next after white men who didn't own land. So there's been a lot of tension historically between these movements, but they did come together at certain points to pass legislation. And closer to the 90s, we start getting the third wave of feminism. So we're talking about intersectionality, the concept of intersectionality. Kimberly Crenshaw talking about how it's not enough to just talk about your female identity. You have to consider how that is affected by your black identity or your queer identity or et cetera, et cetera. You cannot just be woman categorically. You are influenced by your other identity factors. And that brought along, yes, more of the identity politics kind of talk, but it gave us more nuanced conversations about what it meant to be, you know, a white woman, a black woman, a lesbian. Like, it gave us a lot more of that intrapersonal narrative that pushed the movement forward to eventually make it a little more popularized. You see, like, capitalist feminism now, the stuff that they marketed on, girl boss feminism, stuff like that. They've taken a lot of the tenets of intersectionality and marketed them to sell them. But yeah, so that's a very, 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 very brief synopsis. I probably did not do it justice.
I had no idea there was waves of feminism. Wait, so there are 3 waves or there are 4 waves?
So there are 3 that are recognized. Some say that we're in a 4th right now because of all the reckoning with the trans rights movement. So it depends on who you're talking to, really.
Huh. Okay. Yeah, so now the question is, do you think men get paid more than women?
So it has been proven that men get paid more than women, but it's not for the reasons that most people think. A lot of the times it's because when men and women are in a family unit or women are caretakers, they have to take more time off to care for the children, generally speaking. If we're talking about a nuclear heterosexual family, let's say they both have the same exact job starting at the same point. For about a year or 2 as they get into the field, they're making the same amount of money, but she gets pregnant. So she's going to stay capped there while her husband continues to grow. Mm-hmm. I'm trying to like break this down. There's actually a really great, I could probably find the link. There's a great Vox breakdown on this, talking about the wage gap. There's one on Explained, it's on Netflix, and there's also one on their YouTube channel. They actually talk to economists that explain this in better detail, because I don't have much money background, so I feel a little uncomfortable trying to explain this the best way. But basically it's saying that because women take more downfalls for raising children, they lose time, they lose benefits, they lose the potential benefit of getting certain raises. Maybe they lose the opportunity for a promotion because of their time spent outside of the office, etc., etc. So a lot of it does have to do with childcare.
Yeah, I mean, it totally makes sense. Just the time to take even take 2 men, if one decides to take a year sabbatical for some reason, they're obviously going to be a year behind. And I feel so you would say that if a man just took a year away he would be at the same place if a woman took a year away due to childbirth.
Perhaps.
Or do you think there's more?
It's a compounding effect. It's not just the initial event of having a child. It's now the child has this doctor's appointment. Oh, my child hurt itself. you know, they're calling me from school, he's sick, now I gotta go pick him up. It's all of that continues to pile on.
So it seems to be pregnancy. I understand because men obviously cannot get pregnant.
Mhm.
But could it also be a anti-feminism because what you did describe made it seem like it's a woman's job to do, like go to the doctor and stuff. Like, do you think it's now that maybe a man should be the one that does? Oh, he had to go to my child had to go to the doctor. I should go instead of my wife. Like, do you think it's an anti-feminist? I don't know if that's even the right term to.
I mean, I think it should be an equal partnership. So if, you know, that would have to be built, that sort of established, you know, agreement needs to be built by the consenting partners. So say like, hey, we have this doctor's appointment coming up, and you know, Jimmy needs to get his first set of boosters. He's going to have another one in a couple months. I'll bring him to this one and miss work because, you know, you have a meeting. You bring him to this next one. It's trying to make sure that it's not just on one person, because a lot of the times it is. And we do just see statistically that women do more of the child care work. I don't want to discount the fact that there are tons of men out there that are doing this work too, especially single dads. This isn't like a men should be doing more argument. It's more because these things happen, women tend to get paid less, and then if you start factoring in things such as race, the pay gap gets larger. I don't have the capacity to have that conversation because I don't know enough statistics and information to have it, but I can at least briefly talk about this part of the conversation.
Well, I would hope, like, I did going from your perspective because you know how people just like grab an article and just, hey, this is it, and just an argument, but you're the one that actually like studied. You actually studied this, so I want to get your opinion on it.
Yeah.
Okay, you're like the expert.
I would not call myself an expert by any means. I mean, I did this degree, but I also kind of hijacked it and made it my own by making it a hybrid philosophy degree. The degree itself still says it's a women, gender, and sexuality degree, but I have a background in philosophy, and I do feminist philosophy. I do feminist philosophy of disability, if I get very specific. So that's what I did in the program. I kind of stayed away from more of the like statistical, sociological, and anthropological side, which is just like why I feel uneasy talking about numbers and statistics, because that's just not in my wheelhouse.
So before I take the mic away from you, is there anything you want to promote or inspirational words or anything you like to say?
Okay, well, oh goodness, I feel a little on the spot. Well, you know, I think that if you are dealing with a difficult to diagnose condition, make sure that you are ready to be your own advocate. You can do the best that you can. It's not impossible to get the diagnosis that you need, even if you're facing a lot of things in your life that are making things more difficult, such as multiple jobs, school, relationships. You have the capacity to do it. So those are the words I would leave for anybody that's listening. I know we were a little all over the place with our conversation, but we had a good conversation.
I think it's a conversation that should be had, and it should be had, and a lot of people experience it. Maybe they just don't express it as much as, let's say, Emily would, but I'm sure a lot of people do experience it.
Yeah. If anybody wants to find me, I'm over at Zebra Tissues on Instagram.
Yeah, I wanted to know what is your Instagram Zebra T tissues? I mean
T tissues.
Tissues? Or the
Yes.
tissues?
Tissues, like connective tissues.
Oh, I thought it was zebra T and then issues.
No, it's because like since it affects my connective tissues, zebra tissues.
For some reason I never connected the dots till just right now. So now it makes total sense. But thank you everyone for listening and watching, and thank you Emily for coming on here. And I'll see everyone next time. Bye.
Bye.